But one of the things I wanted to educate and talk to people about today is what ART can actually do for your average individual, your everyday individual, your mom, your dad, your worker. The techniques that we often hear about are used at the pro level also provide wonderful success and results for us. And today I've got Ken with me. And Ken came to me, what was that, almost a year ago?
Yeah.
I think June of last year. He's been told by this other chiropractor that's been adjusting his neck and that we can't do any more with him because he needs an MRI. So I looked at his x-rays. I said, I think, we can get him a lot of relief with active release. So Ken comes in and he starts talking to me. He said, I've got numbness and tingling going down my left arm into these two fingers and, coming from my upper back and neck. And the adjustments that the other chiropractor was doing is just not helping. And he says he can't do anything more because I need an MRI. So we brought Ken in and we did a complete evaluation on him. And I told Ken, I said, this could be disc. We may have to do an MRI. But I said, let's try some passive therapy on the neck. I said, we're not going to adjust your neck because if there is a disc involvement or we've got stenosis, we don't want to irritate anything. So I said, but what you're going to get a healthy dose of, guess it, active release technique. And then we also looked at his upper back and we found that we did have a couple of ribs out of place as well as some fixations in that upper back. So we did the exam, brought him in, laid you face down. We did all the heat and then we did the active release. And then we did the adjustment of the upper back. And I think it's fair to say that you were actually quite surprised with the relief that you got after just the first visit without having to crack the neck.
Yeah, I do believe, I didn't sleep for 2 weeks prior to coming here, and I couldn't get in a comfortable position. It was really odd to me that my old chiropractor just was like, I'm done, I can't do it anymore. And when we got in touch with you guys, you kind of looked at the x-ray and were like, I think I know what's going on here. So I ended up personally, when I got here, after you took care of me, worked on the neck as well, but really found the spot that I was in trouble with. You were able to kind of work it, make it so that I can stand up and look normal. That was the first night's sleep I got in 2 weeks, and I just it was a godsend for me because I was in excruciating pain when I first came in here. From that day forward, even that first day, I was able to walk around. That was the first night I got some sleep. So it really, for me, was paramount that I found you guys and was able to get here.
It also ties in with the other paradigm that you always hear me preaching about is we chase pain. Oh, you're having neck pain. We have to adjust the neck or we have to treat that. Yours was actually more into that left upper back.
Yeah.
And when we identified that, I think that's really what gave you the most relief was actually finding the true source of the pain. It didn't take us long to get there.
No.
You had a lot of results or a lot of relief after that first visit. But I would say really within that 3, 4, 5 visits, you were well on your way to being very comfortable.
Oh, I have a manual labor job right now, and it was really tough to even just perform at work. But I would say, yeah, after 3 to 5 visits, I was pretty much back to normal. And still every so often need to get adjusted and cracked and lined up. But at the same time, I don't know what I would have done if I didn't find you guys.
It's not the 3 times a week for the rest of your life, certainly. But I find that you do have to put a certain amount of maintenance or prevention into it. I always tell people your body is the most expensive piece of equipment you own. It's like your car. You got to change oil. You got to rotate tires. You got to wash and wax to keep it, lasting a long time. If you don't, you can see how you can have a car that's a couple years old, but it's pretty beat up. But if you put in that maintenance and you don't let those check engine lights come on, it really creates a much healthier lifestyle for people.
Well, and now you use the car reference. This old cars that had Bondo and duct tape on it is now a classic. So
that's the way we want to keep it. And classic cars, they may take a little bit longer to get going, but once you do, they sure are nice. You see the jerseys if you come into my office or you see my posts that are predominantly revolve around athletics. But I also wanted to inform people that this works great for everybody. And if I can't help you, I'll find somebody that can. But active release and identifying the problem and not treating the pain is going to go a long ways towards getting people feeling better and back to a normal life.